the oral glucose tolerance test, with the brick wife. Being offered a glucose tolerance test does not mean that anyone has decided you have gestational diabetes. It simply checks how effectively your body is managing glucose during pregnancy. Pregnancy hormones can make insulin work less effectively, and gestational diabetes often causes no obvious symptoms. If you have certain risk factors, you may therefore be offered an oral glucose tolerance test, usually between 24 and 28 weeks of pregnancy. Your appointment letter will tell you when to stop eating and what you may drink. The exact instructions can vary between maternity units, so follow the information you have been given rather than taking advice from Brenda's cousin's neighbor on Facebook. You will usually be allowed plain water while fasting. Continue any medicines according to the instructions from your maternity team and contact them beforehand if you are unsure, unwell, or unable to fast safely. Because the appointment takes a while, bring something to read, watch, or work on. It's also an excellent idea to bring breakfast for afterwards. Future you is going to be hungry and will regard this as an act of extraordinary kindness. When you arrive, the first step is a fasting blood sample taken from your arm. This measures your glucose level before you have eaten. Next comes the glucose drink. It contains a measured amount of glucose and is usually very sweet. Think less refreshing spa beverage and more melted jelly bean with clinical ambitions. You'll be asked to finish it within the time given by the clinic, then the waiting begins. For approximately 2 hours, you'll usually need to remain in the department, rest and avoid eating, smoking, chewing gum, or wandering around unnecessarily, because activity and food could affect the result. Plain water may be allowed according to your clinic's instructions. Bring entertainment. A book, headphones, knitting, or a fully charged phone can be invaluable. Trying to reorganize the entire antenatal waiting room probably counts as unnecessary activity. Some people feel slightly sick after the glucose drink. Tell the staff if you feel unwell or if you vomit. They will look after you and explain whether the test can continue or needs to be rearranged. After approximately 2 hours, a second blood sample is taken. Once that has been collected, the test is complete, and you can finally eat your carefully guarded breakfast. Your blood samples are sent to the laboratory to see how your body dealt with the glucose drink. Your maternity unit will tell you how and when you will receive the results. If both results are within the expected range, you will usually continue with your routine antenatal care. If either result is raised, the maternity or diabetes team will contact you and explain the next steps. A diagnosis of gestational diabetes is not your fault, and it does not mean that you have eaten too much sugar. Pregnancy hormones are remarkably clever and occasionally rather inconvenient. In our next post, we will look more closely at what gestational diabetes is, how it can affect pregnancy, and the support and treatment available. One slightly unpleasant drink, a couple of quick blood tests, and one brick at a time.